guys. In this segment, Gage discusses his first couple months as an attending and what that experience has been like. As always, if you like the content, please remember to like, comment, and subscribe to help grow the channel. So we
And
have
so,
one more. We've been meaning to talk about this one forever.
yeah.
So I've been an attending now for almost 2 months. So we were going to I can at least reflect on. It's quick. It's crazy how quickly you lose it. I don't forget my residency experience, but it's already starting to fade because I haven't been a resident for, a year and a half almost. So I can relate it more to being a fellow, but being an attending is it's a different ballgame, and I can't compare it to other specialties, maybe except surgery, because radiology is unique in the sense that it's pretty much one on one, right? It's just me and the image. Nobody else is there to. So if you're an internal medicine doctor, I don't have a specialist that I can send this image to, right? Like I am the specialist.
Mm-hmm.
So, and when you're a surgeon, you're a surgeon. Like it's just you and the patient in that room, one on one. I mean, you have help, but essentially you're taking full responsibility for that patient. So that's one thing that people talk about when you become an attending is it's just your name at the bottom of the report. Whereas when you're a resident or a fellow, obviously you're attending, you dictate it and then they overread it and they final sign it. So they take all the responsibility for it. So you're kind of prepared for that eventuality. Like when you're an attending, you're by yourself signing. But I underestimated how much that pressure is. I assume it gets better as you dictate more, but just knowing that everything I can read, everything I do read has the potential for disaster. Like for me, for the patient, for whatever, it's a lot of pressure to handle by yourself. And you can ask your colleagues, like if you see something and you don't know, you're like, oh, what is this? But that's not going to hold up if you get sued, right? You can't be like, oh, Dr. X told me it was this. So I said, well, it's still your name at the bottom of the report, buddy. So, so that was one thing that I underestimated is just the pressure. Yeah. And it's radiology. I think we've talked about this before, but it's hard to tell people, even in medicine, how busy we actually are, like to describe a busy day. But I mean, if I average 100 studies a day and I work, I don't know how many days a year, let's easy number of like 250. You multiply those out, I have a lot of room for it to make mistakes. Right. And I have to do that every day for the next 20 years. So I'm sure there are studies out there and I've read them at some point, but I forget the number. A large majority of radiologists at some point are going to get sued. And it's not how good or how bad you are. Sometimes it's how bad you are, but it's just a numbers game. The more I read, the more I'm going to mess up, or I have the opportunity to mess up. It's just like your job. The more you scan, the more you have the opportunity to miss or do something or whatever. Right. So it's not like I'm not a bad radiologist in my personal opinion, but it's just simple numbers, right? Michael Jordan says I took thousands of shots in my career. I also missed thousands of shots. You're like, so the more he took, the more he missed. He also made more, but he still missed more. Right. So to me, that was the liability and the pressure of being the one that is responsible for signing is a lot more than I thought it would be. Because I signed some of my own studies in fellowship. I signed X-rays and I did moonlighting where I would sign chest CTs and PE studies and stuff. But I never felt that. I don't know why. I just never felt the pressure in fellowship. Maybe it's because it's a big university. So if someone sues you, they're likely going to sue the university and not you. But I just never felt that pressure in fellowship. And I never had any issues in fellowship. No one ever told me anything about my reads being bad or missing things or whatever. But when you're in a private practice, job, it's just a different ball game. You're just on your own island.
And that's interesting. I think I forget that you're in a private practice now versus when you were in the big university. And so those are two different aspects. You're being a radiologist, but you're a radiologist for different things. For a big university, private practice, and I don't even know if there's other ways to be a radiologist too. VRAD virtually, and so those are.
Well, they're still it's mainly private and academic. VRAD is private practice. They read remotely. Okay. The only other thing I can think of is you can work for an insurance company, right? You could be the one that fucks over your colleague and says, yeah, they shouldn't have missed this, or yada, 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 approves the exam. So you can work for insurance companies and stuff like that. But it's the vast majority is private practice versus academic. And academic is different because not just for fellowship, but everybody there is only reading what's in their fellowship. So when I went to fellowship, all my attendings just read MSK because that's what I trained in.
Right.
If you go to body, all those attendings, they did a fellowship in body and all they read is body, neuro, so on and so forth down the line. So you're much less likely to get sued if you're only reading your subspecialty because that's what you're most comfortable with. Yeah. But in private practice, that's not an option. Right. You have to read things that are outside of you that you read in residency and you're good enough to handle. Yeah. But you're not subspecialty trained in those things. Yeah. And then that's where most people get into trouble.
Right. So, I have a quick story about that. So I've worked with a radiologist that's first year, and they specialized in body. And you start to notice when you're doing different exams with them, how uncomfortable they are with certain things. So like they had put this particular radiologist in breast.
Yeah.
And you know, it was just taking them a long time to get through things. They're like really going over things. And then they started recommending biopsies. They're like, we want to biopsy all these nodules.
Yep.
Whereas some of the other radiologists would be like, no, we're going to do this, this, and this. And so the comfort level of first being new, you know, they're getting put on an island of what they're not used to doing. And I think I didn't realize that, you know, when you specialized, for that fellowship, you focused on that's MSK. Like I read, that's what and then you're like, okay, we know you've been doing MSK for the past year, 2 years, whatever, you know, however long somebody's fellowship goes or body or whatever. Now we're going to put you in breast, or now we're going to put you in like whatever else specialty it is that you don't have as much experience on. Ready, set, go.
Yep. And you can tell, and when people are uncomfortable with what they're reading. But I mean, that's on us, because my group asked me if I wanted to do MAMS, and I said I will not touch MAMS. So I think the radiologist has to kind of put their foot down and know themselves well enough to say I'm not comfortable doing that. Like I won't read like high level neuro. If it's like a PET CT comes through the ER, fine, but I'm not going to read high level. I won't read high level neuro, just like the neuro person shouldn't read high level MSK. Orthopedic surgeon doesn't want a neuro radiologist to read their knee MR, just like a neurosurgeon doesn't want me to read their brain MR. You know, post-op. Like, so we have to know ourselves a little bit better. But radiology is in a good spot, so you can kind of pick and choose. You know, the job market's hot. But what else? So that's one of the things. Yeah, that's one of the things I wasn't ready for. Some other things I wasn't ready for are we have, I don't know what maybe coordinator, like a reading room coordinator, I guess is what you would call her. She handles most of the phone calls. And then if it's a specific question, then she hands it off to one of us. So she handles a lot of it, but like I still have to call. We've talked about giving results. So if there's a PE, I have to call. There's certain things I have to call the provider about. And that, I mean, that's a pain in the ass to try and get a hold of these people. I'm in a stat study. So I think most radiologists probably do what is termed an oh shit scroll. So you scroll through the image first to look for anything that jumps out like immediately. Like if they have a ruptured abdominal aortic aneurysm that you have to call, like you have to call right then and there before you say anything on the dictation. Right. So I think most of us do that. So if you happen to catch something, if I catch a PE on that scroll, I'm like, well, shit, now I have to call. So then it takes 10, 15 minutes, whatever, I have to find the number. I have to call. We cover a lot of rural sites. So you have to either call radiology and have them transfer to the ED or whatever. So that can take 10 or 15 minutes. Then you have to dictate the damn study, which takes another 10 minutes. So just one study could take you 30 minutes. And when the list is 300 deep, you're like, oh my God, this is painful. So giving results, like the interruptions, I guess, is how I would sum that up. Phone calls, other providers wanting to talk to you. You don't deal with that in fellowship very much because they usually want to talk to the attending. So they ignore you as the fellow. And we had a reading room coordinator. She handled most of that as well. But the interruptions are crazy.
Yeah. And you know, I can even correlate like quickly with the interruptions. You know, I've worked at different places where the radiologists have us call. And so they continue to do their dictating and we call the results to whomever. And so now, you know, we have X amount of exams and we're making the phone calls and I'm answering the phone calls and I'm also scheduling and trying to book patients on our schedule, which, you know, it's a full thing. So you're just like putting people where you can't really have time to put them. And so if you have that coordinator spot, man, that's so nice to have. I wish
she does help out a lot. Yeah.
You don't realize, and you don't realize how much somebody ends up helping out till like they take a day off or something. You're like, well,
that's when you notice it.
You're like, oh my gosh, like
we have to carry the phone that she normally carries, and you're like, oh my God. But
this is a lot, yeah.
So, I mean, I don't want to be all negative about being an attending. Obviously, the paycheck is nice. I'm not gonna lie to you about that. So that's what I've been building towards for 15 years is that paycheck. So, I mean, that helps. But all right, guys, that'll do it for today's segment. As always, if you like the content, please like, comment, and subscribe to help grow the channel, and we'll see you in the next one.